milligrams of caffeine, 1 12-ounce amount of Diet Dew, 55 milligrams, 8 ounces of Ben & Jerry's Coffee Heat Bar Crunch, 84 milligrams of caffeine.
What?
1 Fuchs mint, which is like an energy mint,
Coffee.
contains 100 milligrams in 1 mint.
1 mint, 100 milligrams. Oh
2
my God.
Mountain Dews in 1
The Monster Energy drink, 160 milligrams.
I need one of those
1
right now.
12-ounce Starbucks brewed coffee, 195.
Holy cow. No.
1 no-dose,
That's what we
200
need from
milligrams.
Starbucks.
Energy shot, 242.
I'm gonna die.
Rockstar, 250.
I wonder how much that powder costs. The powder for a
So
workout. Pre-workout.
caffeine irritates the bladder. There are some medications that contain caffeine as well. Helping your patients look at medication labels is important. I had some clinical hours that I did with an industry nurse at Honda, and she said they had males that were coming in for Midol. And she couldn't figure it out, and she figured out they were coming in because they wanted the caffeine. So she said she couldn't figure out why males were coming in for PMS tablets, and that's why. Educating your patients about reading labels. Do contain some caffeine. Medications that don't contain caffeine, if you're giving your patients some suggestions for pain medications. Consuming a high amount of caffeine increases your risk for urinary tract infections, increases your risk for bladder irritation. Other things also do: citrus foods, alcohol, artificial sweeteners.
What's his
So
problem?
educating your patient about restricting and identifying sources of caffeine is important. As I talked about earlier, educating your patients about potassium sources to either increase, if you're a risk, but your patients with renal problems would have probably what level of potassium? High or low? High, correct. So probably the discussion with that renal patient will be more like restricting sources of potassium. So the serving size for these potassium sources are primarily 1 cup. And I recognize that it varies between brands and all that kind of stuff, but on average, it would just be, when you're looking at studying for that, just study the big one. You don't have to study the 55 sources of potassium. And as I said earlier, banana will not be a choice. Just because that was a 135 question in the year 265. Okay, so for all these different sources of potassium, which are good sources of potassium for your patient that needs it, they're also high in potassium for that patient to say, you might need to stay away from these. 1 cup of cantaloupe, 407 milligrams.
Potassium?
Yeah.
Orange juice,
Oh,
496. A cup of yogurt has a lot of potassium in it as well. A banana. Yes.
Just one banana.
That's a lot. So your patient
I eat a banana.
potassium. Vegetable juice. A lot of potassium in that as well.
No wonder when I come take tests, my heart is just
Spinach.
because I eat a banana and my peanut butter or something.
Whichever that spinach
39.
though.
Wow.
Tomato sauce. A lot.
Wait till she gets to
Lima
avocado.
beans.
Oh yeah, avocado's one. I
1
love
baked
avocado. I eat an
potato.
avocado like a fruit.
Oh, that's way
A cup of raisins.
That's a lot of raisins though. Avocado.
Ugh,
So educating your patient to what are sources of high potassium is important.
just
You
don't
don't
eat.
have to know the recommended daily allowances within this course, but this is what it is, just so you know. Again, as I said, identify the items, the food items that have the biggest sources of potassium in them will be most important for you to know, which is the ones we just went over. Lots and lots of things fall into the category of high potassium. Educate your patient how they can Google that, look up some credible sources to figure that out, rather than with some printouts and so forth. Sodium, as you know, our patient already has issues with high sodium, with water retention. So we definitely want to teach them about restricting their sodium for your patients with renal. Here are your serving sizes for these, which crack me up. 1 ounce of peanuts. And 2 slices of that. Then how many make a sandwich with that beef with just using 2 slices? This is a TV dinner. Again, 1 ounce of cheesy puffs. Tablespoon of soy sauce. These are the serving sizes that we'll review. High sources of sodium for all of these. A tablespoon of ketchup. 1 ounce of peanuts. 1 ounce of cheesy puffs. Again, who eats 1 ounce at a time? I'm not sure. High sodium source there. 2 slices of that thin beef. 604. A half a cup of spaghetti sauce. 1 can of creamed corn as we head into Thanksgiving. This is 1/4 of 1 Tombstone pizza.
Don't eat the whole time.
Tablespoon of soy sauce.
Oh wow. Oh, you know how much I put? Ooh, I just
1 can of chicken soup.
And these are like out.
1 TV dinner. So, educating your patients, these are sources of high sodium. We need to restrict your sodium, helping them read labels, teaching them that reduced sodium does not mean it's necessarily good, right? If you're in the store and you're like, there's 6,000 things to pick from. Reduced sodium just means that it's reduced by 25%. So if it has 1,000 milligrams of sodium in it to begin with, how many milligrams does it have in it if I can put reduced sodium on my label? It still has 750, a lot. So just because it says reduced sodium doesn't mean it's a good choice for you anyways. It only means it's only reduced by 25%, and I can still put that on my food label. So help educate your patient, no, this doesn't all mean the same. This. So teaching your patient the significance of that, reading their food labels. Again, you don't have to know this part, but interesting. The recommendation is less than 2,400 milligrams a day, which equals 1 teaspoon of table salt. So those of you who eat popcorn and you have, all that kind of stuff. So how difficult it would be for your patient to start to limit their sodium when they're used to some of those sodium contents. These are all things that mean sodium. Working with your patient, tell me what kind of foods you like. Let's go over a menu that you think would be doable for you. If you're going to tell them to eat this and not eat that, and don't work with them to figure out what they like and what their preferences are, they're probably going to be compliant anyway. So what are some things we can start with? What kind of foods do you enjoy? Tell me what you normally eat during the week. Maybe help you figure out how we can swap some things out for something that's going to be less sodium. And it can't be all at once. So we put away a little bit at a time, see if we can that works for you, all those kinds of things. Frozen dinners are usually huge with sodium content. Some of the ready-to-eat cereals are not great for that either. Vegetable juices, I think I'm drinking something healthy, and then look, I've got 653 milligrams
Bloody
of
Mary
sodium in a cup. Canned vegetables are terrible. Deli meats, some soups, a lot of your condiments are pretty high, as you can see. A tablespoon of soy sauce equals 1,000 milligrams. There are some low salt, no salt versions of it. The problem is sometimes people buy them and then they take the table salt, and what do you do with it to make it more flavorful? There you go. Some of the spices have a lot. Peanuts, salty peanuts will not be a sodium choice for you in a couple weeks. Neither will salted pretzels. Pre-packaged, a lot of those are high in sodium. Again, some of your condiments are pretty high in sodium. Helping your patient read labels. Problems when you go out to eat. Because sometimes, and oftentimes you can bring your own condiments. Something is lower in salt. You can go online and see what the sodium content is of some of the restaurant foods. So helping your patient figure that part out. Okay, here are some of the culprits from McDonald's. Even your grilled chicken, you think you're eating healthy, right? Yeah, not so much.
Ooh, quarter pounder's not that bad.
One packet of that
$7.30?
Italian dressing was 730 milligrams of sodium. Here's Burger King.
Oh, no wonder their
You think you're
stuff
eating
tastes.
veggie burger,
gross.
1,100
Damn.
milligrams. Yeah, why are you eating food while driving? Knowledge doesn't equate to compliance, remember? Here's Wendy's. Bacon eater, obviously, but here's your home style. You're doing good eating chicken and you're eating 1,100 milligrams of. Here's Panera Bread. Sorry to burst your bubble.
Not any better.
What about Chipotle?
Okay, I don't know if y'all have some last, but now you're gonna feel guilty about that.
I had a book with all the restaurants and stuff.
Did it show you
Sweet,
that?
yeah. Somebody gave it to me. Somebody who had diabetes, I think, and it had all the nutrition, so we have all the restaurants. They showed everything.
Yes, there will be some dietary questions on there, primarily identifying potassium sources for your patient, given the potassium level, what diuretic you have him on, and what foods to either A, stay away from, or foods that you should increase. So if you know those primary potassium sources, you use that. Helping him understand what are some high sodium sources. That reduced sodium doesn't necessarily mean good for you sodium, right? Because that just means reduced by 25%. Sources of caffeine, that could include your medications. So read your medication labels. Sometimes there are sources of caffeine that you don't even realize. I'm afraid I am. All right, we'll just do some review courses and stuff too. What we do delegate questions should be easy right now. Let's have a talk about this. Yeah, why can't you have me take your vital signs for you? Yes. Everybody clear and good with that? This is calculating the CBI. You won't have to do that for the sake of the test. The bag is going in, the urine out. You always subtract what we put in with the bag. You won't need to do that. So we have put those big monster bags in when we're irrigating for continuous bladder irrigation. You have to calculate the urine output, has to be the amount going in. There's the fluid going in, so you put 1,000 in, we'll say, the patient's got 1,800 in his urinary bag, what's his true urine output? You put 1,000 in, he has 1,800 out in his bags, how much does he truly have in urine? 800. Does that make sense? You gotta calculate how much you put in over here.
It's like the opposite. You subtract. So the number you put in is.
We had a patient this week that had a tumor removed, and the continuous bladder irrigation was to irrigate all the blood and blood clots and crap out of that. Yes, because the whole irrigation is to irrigate all the blood out of the bladder, for whatever reason that's in the bladder. Our patient had to get it. Nobody has one on Monday? Yeah. Okay. Thank you. Good question. Okay, what would you assign to an LPN? Can you assign assessing? No. Can you assign monitoring a patient? Monitoring. No slight to the LPNs, because I know you all do a lot, but stick with what you know about. Okay, so help me decide between 3 and 4. Correct. Anti-neoplastic means chemo medication. And even if you didn't know that, what we just talked about, 4 is the least involved, right, out of all those options. So. Is this a priority question? Anybody else want anything besides 4? 4 is correct. Everybody good with that? Okay, the ileal conduit surgery, he absolutely should be having urine. Anybody answer on that one?
Phil.
Absolutely. If you picked increasing your vegetables as a priority, it's probably not the right. Anybody? Yeah, absolutely. The patient's having significant complications.
Oh my gosh, I thought it said continue.
See, that's what happens with test questions sometimes. What did you say? Anybody have? Okay, why did you decide 3? Why did you rule out 1 and 2?
They don't fire up, right?
And 1 and 2, yes, but 1 and 2, there's no fever, right? And we don't have any thought that there's any indications of an infection going on or inflammation.
There's no infection signs.
Correct.
So the trauma would explain the.
Correct, the blood and the urine. Correct. Anybody have thought?
No hypertension. Because the question why that author is being answered.
And what else is significant about her history?
She did a good story.
Fall from the
Trauma.
horse.
Yeah.
The nursery. Two.
Which one of those lab findings is specific to a renal?
2.
Yes. So 1 and 3 are related to each other, which is actually sometimes the case when we have a patient that's got renal problems, right? But it's a renal disorder. We're not 100% sure whether it's a chronic issue that it would affect the erythropoietin or not. And so I'm kind of like, I don't know about 1 and 3, but I know we talked about creatinine levels are specific to renal problems. So if you're kind of debating about all of that, what is specific to renal that maybe not wouldn't apply to anything else? Everybody okay with 1?
Yeah.
A week after, we don't have any indications really, we don't know about the kidney infection, but given the fact that it's a week afterwards, blood pressure's up, that doesn't fall the criteria of chronic for sure. There's no indications he's got a kidney stone. What's the number 1 cause of urethritis in a male? STIs, STDs, whatever you want to call them. So which answer is probably going to be what you want to pick? 4. Because urethritis in males, the primary culprit is sexually transmitted infections. And even if I didn't really know that, I would have picked the only answer that had anything to do with male parts. Even if you told me it was a male patient. That might have been a good way to get your pick 4, even if you weren't 100% sure about the rest of it. You were looking for what? What's the question? Adverse effect. You're looking for something that's going on that's not going the direction you want it to go.
4.
Correct. Does that make sense?
Yep.
We want the creatinine level to go down, right? An adverse effect would be that VUN is not going down, that's going up. 4, that's pretty straightforward. Anybody have questions about those folders? You feel clear about what is important now? Anybody, anything? What other questions do you have? We're gonna start the ATI at 2:15. And the ATI, just do your best on it, process the questions like you've been learning all semester. It'll be fine.
Forgot about the dosage count. I did forget about the dosage count. I might need that to come back.
Oh
I
yeah.
might need that to come back.
You want a pencil and stuff?
Sure, that would actually work probably a lot better. I'm terrible at math. Not at this math, but just like generally I'm terrible at math.
Oh, shit.